Welcome back to MPN's Family Peer Support Provider Training Series, video 4 of 4.
Okay, next is Family Peer Support and You. Family peer support qualifications and standards. The parent or caregiver with lived experience raising a child with special healthcare needs, including behavioral health. They have to have significant experience and currently working within the children and youth with special healthcare needs system. They need to be able to articulate the process of their own journey and their own wellness. They need to be a team player. They need to have good computer skills and communication skills. And they need to be able to stay within the scope of practice. Family peer supporters are not friends to those they serve. They're peer supporters. They're also not therapists, social workers, doctors, case managers, or care coordinators. Family peer supporters shall not engage or offer advice in the matters of diagnosis, treatment, or medications. So what are the elements of effective peer support? So these elements are found consistently in effective peer support programs. They need to understand and know their own journey. They need to appropriately be able to connect it to another individual that they're supporting. They need to be able to connect their emotions of others and understand things like chronic grief or the stages of adapting, stages of change. They need to be able to mentor and have shared learning together. There's no expectation that the family peer supporter knows it all, right? And then they're going to leading families to chart their own course. The family needs to be able to make their own decision and what's best for them. It's called support. So we're walking with the person, we're not walking for them. Activation, the importance of a dream and purpose and healthiness, what the family wants in the future. Healthy advocacy skills such as resiliency and knowing the system and what does that really look like. So helping a family with peer support fit in with your practice, what does this look like for you in your agency? Well, the first part of it is as with any new employee, we have to help new people understand the staff, the clients, the paperwork flow, the information. I mean, this is important for any new employee, okay? The family member is going to be somebody who comes into your practice who may be a client or a former client or may have this experience, but they have it from the client's viewpoint. They don't have it from the staff's viewpoint. And we really have to help them be able to work more efficiently within the system. And the peer supporter, conversely, will help the system work more efficiently. An example of this might be if you have a waiting area and you have families that are waiting for an appointment, that's a good place where you could have a family peer supporter go out and talk with people and meet with the kids. The relationship can start that early. Okay. Helping the families be readily available, but not in the way. We need to help the peer supporters. How can they be available? Again, it can start in the waiting room. It can be during an appointment to bring them in. It can be after the appointment. It could be in a support group. There's lots of ways that you can engage. And all of this will increase the value and the reputation within the office. It's important to consider the other staff members. You have administrative staff that are in the office. They also have to understand all of what Beth and I are talking about here in this training. And you have to find a good balance and integrate the family peer supporter into all the things you do. It's also important that we share the expectations of what is possible for the peer supporter, present and focused when at work, right? Important part of the practice and the team so that they understand what is your culture there, and that the family peer supporter is there to serve the staff and the families.
we teach this in our training to prospective peer supporters that we will get referrals from our providers to the level and degree that they do a few things. First of all, making themselves available to providers. Providers don't have time to go look and see if we're there or try to find us. That number two, that they make their usefulness known to providers, meaning here are the things that I can take off your plate. Okay, if you're having a long conversation about a kiddo's IEP meeting, I may know more about that than you do. Let me do it for you. I may have a better list of local resources than the doctor does. Let me take that off your plate. Right? I have the time to hear about the emotions that you're feeling about certain things going on in life. A provider may not have that time. They also make their usefulness known to families. Here's why I'm here. Here's what I can do for you. Here's how I can serve you and would love to serve you. Then how well we handle the referrals that we get will determine how many referrals we receive in the future. And if I could only say one of these, it would be the last one, that we will receive referrals based on the degree of trust that we build with their provider and our ability to handle a situation appropriately. When we show those things, providers grow more and more comfortable with sharing their families with us. And that's what we're trying to get them to do, so that they are more efficient, that their job satisfaction goes up, and so that families receive more of the things they're looking for in a really time-efficient way.
Okay, one of the things with family peer supporters, behavioral health peer supporters, that's really important. And when you begin to think about healthcare and the work that is done, we talk about being healthy all the time. We talk about wellness. But what does that really mean? And are we really achieving those things? So in the last decade or so, this has emerged in Japan. They have this new word called karoshi, and it literally means overworked death, where individuals are working so hard that they're actually dropping over at their desks or on their way home. They're dying because we're just working and working and working and working, and we're not really paying attention to the health and wellness of our staff, of our employees. We're very focused on, in this case, the families, the clients coming in the door. But a family peer supporter is going to come with a little bit different approach because they're coming from a place of wellness and recovery. So they're going to come in with that. And if your culture is not one internally where you value things like self-care, you're going to notice right away that there's going to be some rubs that you're going to have with the peer supporter and your current culture. And it might seem strange to some of you. You might not. You might think, oh, of course we're into self-care, and right? But here's some data for you from 2021. Clearly, in the healthcare field, we are not paying attention to taking care of ourselves. So something to consider. The other thing with self-care for the family peer supporter is that they need to have regular clinical supervision. So again, this is by a licensed professional who's going to meet with them each week, check in with them, see how they're doing, work on things like self-care plans, right? We're going to monitor caseloads. You can't just dump 200 new clients onto your family peer supporter. They're going to be completely overwhelmed. So we have to monitor and temper the caseloads. We have to be aware that there are natural ups and downs with things like chronic illnesses and then the stress that goes along with that, and the causes, the healthcare issues that can come along. Your family peer supporter may only work part-time. They may not be able to work full-time because they may be caring for their own child. So that's another way that you can temper that. Don't have this expectation of the peer supporter is going to come in and work 40, 50, 60 hours for you, and you're just going to give them all these clients. If you need more family peer supporters, then my suggestion would be to hire 2 or 3 to match your caseload. Okay, advocacy. So one of the things that always comes up with peer support is advocacy. This is part of the scope of practice. The peer supporter, again, is going to come in with an awareness around health and wellness, either the medicine wheel or the 8 dimensions of wellness. So another component is going to be around advocacy. So when we're talking about advocacy, we're talking about empowering families to advocate for themselves. And we're also talking about the peer supporter advocating within the team. So there may be things that you do in your practice that actually are harmful to the families that you work with, but you're completely unaware of it. Because to you as a clinician, that makes sense. But the peer supporter is going to come in with a very different viewpoint because they're a utilizer of the system. So how that feels to the end user is often very different than how it feels to the people making the decisions or setting policies. So you can expect the peer supporter in staff meetings and clinical supervision meetings, one-on-one meetings internally to begin to advocate for things like maybe policy changes, maybe the way you handle clients in a certain way, or follow-ups or waiting lists. These are real common ones because these add so much stress to the families when they're waiting for services. How do we mitigate some of that? How do we integrate the peer support? How do we shorten things like wait times, or right? And so don't be surprised if the peer supporter is vocal in this way. This is part of their job. And their job is also to begin to empower the family. So don't be surprised 6 months into having a family peer supporter that your families become more vocal. There was that statistic earlier that demonstrates that families feel more confident in going into a meeting regarding their child's care. They feel more confident because the family peer supporter is actively working on that with them. And so we talk to them in training, talk to peer supporters in training, and the difference between assertiveness and aggressiveness, right? We talk to them about that you can advocate and you can be assertive and you can have good communication skills. This is not about aggressiveness. This is not about saying you're this and you're wrong and all of that kind of thing. Okay. And we talk to them about their own emotions because they could easily be triggered. Again, as someone who utilizes the system, when you begin working within the system, it can often trigger negative emotions and we can have emotional outbursts sometimes. And while that's true in most people, I think it's people are more sensitive as peer supporters because they have that lived experience of using the system, and maybe it rubs them the wrong way. So that also is part of the training. Okay, so the delivery of family peer support services, Montana's Peer Network, we're running this pilot project. We have family peer supporters. We're collecting data. We're organizing the components for the profession of family peer support. So, referrals could come really from anywhere. Our hope is that someday there would be family peer supporters working in all of the locations, right? And they're not limited in any way. So they can come via phone, they can be emails, they can be texts. And again, it can be handing the information to the family for the family to reach out. It can be set up so that you as the provider, that you reach out with permission, right? I mean, it can be set up in a number of different ways. And again, your peer supporter might not be working full time. So you're going to have to develop internally a system. Okay. Where do the peer supporters meet? They can meet in your office. If you have office space for them, that's obviously ideal because you have the families there. But often it's going to be in their home or it's going to be in the community. I already mentioned wait lists. So think about this as a very flexible employee who could go to somebody's home and check in. Maybe they don't have an appointment for a few months. Well, how are they doing in the meantime? Instead of us waiting in the system for the crisis to happen or 3 months until the next appointment, maybe checking in and doing some prevention work, that's an ideal way to utilize a peer supporter. And again, it's with the advent of Zoom, we all sort of learned during COVID, we can utilize Zoom for healthcare. It is approved for peer support. You can do it in person, you can do it on the phone, you can do it by appointment. And sometimes it might be even on call. You might have situations where you have folks are waiting or somebody can't get in and they need to talk to somebody. Hey, is our peer supporter available? Right? It can be during the actual appointment. This is ideal where you have the provider and you have the family and the child and the peer supporter all at the same time. You're going to have the most success of the family working long-term with the peer supporter if you can do that all together. And we realize time is of the essence, and often there isn't time right there. There is no limit to the length of service. So currently for behavioral health peer supporters billing Medicaid, there is no limit on the number of meetings they can have or the length of time. And there's no requirement for diagnosis. If you have a peer supporter working in your clinic, you can utilize them.
So kind of just to go over what we covered and kind of throw out some talking points for you. Just kind of in a nutshell, what is the benefit? Why family peer support? And how does it work within systems? So family peer support provides peer-to-peer support for families, which reduces the feelings of isolation and guilt and increases protection against chronic stress. Providing support for early intervention, diagnosis, and treatment reduces the risk of substance use and improves health outcomes.
Provides support in communities across the state, including urban, rural, frontier, and tribal lands.
Provides uninterrupted care during transitions, covers the gaps in services, and gives access to after-hours support, which reduces the use of crisis services.
SAMHSA included family peer support in their recently published National Model Standards for Peer Support Certification. So if you would like more information, you can contact either Beth or myself. You can email us or give us a call. You can also visit our website. We have an entire webpage designed just for family peer support. We offer trainings, on-site trainings. We offer family support and consultation to help you plan, implement, and operationalize family peer support.